Good morning. For those of you planning to come down, if you could expedite that, that would be great. Thank you. My name is Michael Bzdak. I work at Johnson & Johnson, and I have the honor of being invited here to moderate a conversation with two amazing people, Lesley-Anne and Amanda Puckett. It's going to move fast. Unfortunately, we won't be hearing from you, but I'm going to leave my door open to any questions that may come up from this session, because I feel bad that our time is so limited that we can't engage you more directly. First, to introduce these two amazing people. Amanda works at IntraHealth as a technical advisor for human resources for health and knowledge management. Lesley-Anne Long is a global director of empowering frontline health workers, a former family law barrister, I just love saying that, and a career committed to law, social justice, and child rights. So I'm going to set the context for why this conversation is important, and gratitude again to SwitchPoint for elevating what will be a series of vignettes around Ebola. First, if we could advance that slide. Thank you. Just to ground us a little, the outbreak started in December 2013. A year ago, when I was here with many of you, the WHO statistics showed 239 cases and 160 deaths overall. However, at the end of last year, the confirmed cases exceeded 20,000 and confirmed deaths exceeded 7,800. And the most recent data from a couple of weeks ago, cases exceeded 25,000, while deaths neared 10,500. Obviously, in these statistics, we lost many frontline health workers. And I just want to take really 1 minute of our precious time to just bow your head, look up, close your eyes, and try to remember and honor these heroes on the front line. Thank you. Some conclusions. When I was asked to do this, I dove into all the literature, mostly the recent literature, to learn everything that I could about what we learned. Because the purpose of this panel is to offer us some hope, to get your minds thinking about what we might do differently. And I'm going to run through quickly 5 conclusions that I gleaned from the literature. First, weak health systems failed a stress test. I think we can all agree. Second, it's demonstrated our inability as developed countries to provide adequate support to strengthen health systems. Third, we experienced shared vulnerability, which means shared responsibility, and will require in the future sharing of resources and sharing of information. 4, it was a global failure. And 5, quoting Paul Farmer, it was an example of the terrorism of poverty. So why is this conversation important? And my questions to my 2 colleagues will be about the future, about hope, and about promising practices. So 2 quick points about why we need to learn more and act fast. Ebola is far from the most infectious disease known. 2, there's a significant chance that an epidemic of a substantially more infectious disease will occur sometime in the next 20 years. So going forward, and I'm going to read a quote, and you'll never guess where it came from. One of the lessons that most resonated with me: we must learn to listen if we want to be heard. So I'm going to repeat that later. I want you to think about that. And I'll give it away where that came from. The WHO published an amazing document just a few days ago about lessons learned from the Ebola crisis. So things like humility, they actually use the word humility. And I think implicit in we must learn to listen if we want to be heard is humility. So beyond humility, we need resources, capacity, the authority, more engagement in the community, and global coordination. And we're going to touch on all these points, and I'm going to direct my first question to Lesley-Anne. So you're out there, you're talking to many people, and what are you seeing as some promising practices around health system strengthening?
Okay, thank you, Michael. Collaboration is something that we've heard mentioned by all of the speakers here this morning, and that's been, for me, one of the most inspiring things that I've seen in a field that is normally not collaborative. Global health development is intensely competitive. It's essentially donor-driven in many cases, and people are competing for the same money. And so they're not used to sharing their expertise and sharing their ideas. They're used to containing that to get the best chance, to get the best advantage to win the grant. And what's been really inspiring is that it's taken a tragedy and a health crisis to start bringing people together. And just a very small example of that was, and very simple, IntraHealth International and Empowering Frontline Health Workers decided to run a webinar series on how could organizations help support frontline health workers. And within a week, we had over 20 organizations volunteering their time, their expertise from 5 countries to join those webinars to facilitate the conversations. And we had over 750 people from 75 countries registered and signed up and watched those webinars and commented. And the comments they left were about, what can I do to help? What can I share? I've got content I can share. I've got health workers who are willing to go and do training and support in the affected countries. And what's been the other inspiring thing from that is that collaboration appears to be continuing to move forward, and organizations are working together to try and resolve issues that before they were doing separately. So I think that's, for me, the big takeaway.
Thank you. Amanda, would you like to add anything?
Yeah, there's been amazing collaboration amongst international partners, as well as in the region. Just last week, I read that the African Union and the CDC are joining forces to create an African CDC so that Africa will be better equipped to respond to outbreaks like the Ebola epidemic and others. And I've spent some time in Sierra Leone and Guinea this year, and I've seen some very promising practices stemming from the ground. And one example is eHealth Africa's call centers that they have set up in the Ebola outbreak countries. These act like a 911, so that if anyone has questions, they can call for free, and they'll get an operator. They can ask questions about Ebola, they can report a suspected case, ask for help for a safe burial if they need it. And eHealth Africa set this up in the context that it would be successful given the logistical challenges that are existing in these countries. So that's one of the promising practices I've seen on the ground, and that will continue after the Ebola response and strengthen health systems.
So since I talked about health workers earlier, and that is my focus in my work, and I know IntraHealth shares that commitment, what are you seeing around health workers being better prepared or trained? Anything promising?
Yes, I think there are some improvements, but there is a need for much better quality training. Tutors are not well trained and supported. Empowering Frontline Health Workers did some research last year, and we held 7 international events looking at the information and learning needs of health workers on the front line. And what came back very clearly from that research and the workshops that we held was that they received very little training. The training is, as I said, poor quality. After their initial training, they probably get very little other opportunity to refresh that training. And they're working in unbelievably stressful situations even before Ebola broke out. And so providing that kind of quality support, having global standards around competencies for health workers so that people know how to measure whether or not someone has been trained well and effectively and can put that training into practice. And one of the things that we're doing is creating an online global repository of content that we now have over 80 organizations are going to share their materials with us for maternal and child health so that anybody can access that content, whether it's a health worker herself or himself, training institutions, NGOs, ministries. They know that they will have a central repository of curated, quality-assured content that is relevant for frontline health workers in low-resource settings. So that, again, comes back to the point about collaboration. That's not something that one organization can do on their own, but when you can get 80 organizations doing that together, it's enormously powerful.
Thank you, Amanda.
I echo that. We really need to invest in health training institutions for health workers. They need resources. That means they need libraries that are filled with books with up-to-date relevant information. They need simulation models to practice on. You know, if you want to train a good midwife to safely deliver a baby, give her the tools to learn on. They need strong practicums and really good experience before they're deployed so that they know what they're walking into when they walk into a rural health facility to deliver services. I'd like to see more training around digital health. We're doing a lot with technology and a lot of amazing things. We need to incorporate that into training, so that's the norm before they walk into a health facility. We need to make sure faculty are trained and better prepared to educate our health workers, and we need to make sure that curriculum is updated. With the Ebola outbreak, you know, a lot of health workers were never trained on anything to do with diagnosing or treating Ebola or how to protect themselves from Ebola. So I'd like to see that and other infectious disease and epidemiology put into curricula. But furthermore, we need to do better to train those health workers before they ever even become health workers and know that they want to become health workers. And that's in investing in primary and secondary education.
Great, thank you. One of the big calls from the WHO report is around global coordination. I think we all understand what that means. It gets a little more complex trying to see it in action. So back at you, Amanda, what are your thoughts on this global coordination and who should be doing it and how should it be done?
This makes me really excited because we've been talking, those of us working in health information systems and mobile technologies, I'm representing MHERO, have been coordinating with other organizations and donors in a way that we have never done so before. One example is the USAID hosts these data harmonization calls every Friday morning at 8:45. We have an opportunity to call and check in, just give some updates, ask if we have any urgent needs. Organizations that have been on this call include IntraHealth and DMAGI, Empowering Frontline Health Workers, USAID, CDC, DOD, the White House, UNICEF. And it might seem like a very small thing to have a check-in call once a week on a Friday morning, but it has given us a platform to collaborate, to talk, to share. And enormous things are happening from this. We're all actually going to be gathering next month in Accra, Ghana, face-to-face, and talking about interoperability of health information systems, talking about governance of data. These are big things that have an impact way beyond Ebola. And so I'm really excited and happy to see the type of coordination and collaboration that has been birthed out of the outcome.
Would you like to add anything?
Yes, I think having this kind of momentum makes it easier to see that it could potentially be sustainable. My fear is it could go back to that very fragmented, uncoordinated, uncollaborative approach once the crisis seems to have abated. But I think the momentum that these kinds of conversations is creating is very powerful. There will be a number of follow-on events from the one in Accra. So it's not just a one-off where everyone gets into a room and talks and then goes away at the end of the week and nothing really happens. Those conversations are staged with ministries of health, of finance, of ICT, with NGOs from the affected and surrounding countries. And those people will be part of those conversations going forward. Because there's a bit of a tendency, you know, to have the conversations in the West and come up with draft recommendations and ideas that you then present as if the thinking's already been done here. And that's just completely the wrong way round. And so these conversations are incredibly inclusive, which I think is also a really important word to take away from this series of events.
Well, what I'm hearing about your event in the UK is that there will be actions coming out of it. I mean, I think, I'm going to go off on a little tangent here, or a little rant, about going to meetings and, walking away excited about what you heard and having no outlet to make it actionable. So if you all want to take a personal pledge that you won't go to any meetings without outcomes, I mean, that's one action that we can all take, and I think the world would be a better place for that. I mean, small actions for you here. I mean, you should have targets about, I want to meet 12 people in 4 different sectors while you're here. And having been here twice, I think it's a really smart strategy, because I've never been at a meeting with so many amazing people that have so many amazing ideas, and it's just your loss if you don't meet at least 12 people in 4 sectors. So, major goal for you. Okay, so moving on to a question around the global conversation. I think we could all agree that everyone is at the table in some way around this crisis, but what is missing? Who is missing? Like, why isn't there more of a coordinated response, and especially going forward?
A lot of the solutions that we've seen have been connected to technology, and there is no question that the power of technology, from a very simple mobile phone to something much more complex, has a critical role to play in health system building. But a couple of speakers mentioned earlier this morning, and Michael introduced his presentation by saying we really need to listen. And I think one of the big issues in the response to Ebola was that those involved in the response didn't listen to what people really needed, and they didn't understand the enormous impact of cultural practice and social mores and the connections that families have to each other and the importance of their burial services. So just saying that by texting a message that you must do this, this, and this for safe burial, that's not going to bring about behavior change. Behavior change takes generations sometimes. And so I think what sometimes is missing is the deep understanding of what it's like to be somebody in a very rural community, terrified, overwhelmed with information, not knowing who to trust the information from, and therefore retreating and hiding and not reacting in a way that we know is best for best health outcomes. So I think not listening and a lack of that deeper understanding of what it means to be in a particular situation, if that doesn't inform the solution, then the solution will be short-term.
Thank you.
Mm-hmm. I echo the same thing that Lesley-Anne says. I saw this in Guinea. Guinea is a country where Ebola started, and it's the one country where they're still struggling to get the number of new cases down. And a lot of the reason is the resistance of the community. I have a friend who works for the Red Cross who does all of the safe burials, and she said at least once a week when a team goes into a community to take away a body for a safe burial, rocks are thrown at their cars because the community is upset with the way this is being handled and they don't understand. So we have to involve people at the community level, at the stakeholder level there, national governments when we're talking about coming up with data and information systems. And we have to listen to them, just as Michael referenced earlier. That is where the real change is going to happen, after we listen and then create our innovative solutions.
I'll repeat it again. We must learn to listen if we want to be heard. And again, coming from the World Health Organization, I think it's pretty powerful. So my last question, and this does involve everyone here, how can we all be more engaged in keeping attention fixed on the solutions that are happening at all kinds of scale that will lead to well-functioning health system? I'll ask Amanda to go first on that.
So this is hard because health systems, huge. That's a lot. And we're all ingrained in our day-to-day, and it's hard to get out of that. So I think what I would charge you all here with is to take a step back, take a beat. Go up on the balcony, so to speak, and look down at all of the actors in this space. Who is working in your field that you could collaborate with? Ask them questions, like what would you, activities might have some synergies with some things that you're doing? Where do you see some possible information sharing? Take that moment to step back and reflect, and then get back on the dance floor and dance. Talk, act, engage. Don't just think differently, act differently, because that's where the change is going to come from. You have to be bold, and you have to be brave, and you have to push people, make it a little bit uncomfortable, because that's where that restlessness is where change is going to happen. And if we all do that in our space, all of our work together, we will make impact, and we will strengthen health systems. We'll support health workers, and we'll ultimately save lives, because that's what we're all here to do.
Yeah, I think it's a really good question, Michael, because it's easy to be engaged when you're seeing thousands case numbers in the paper. You know, you get 2 cases in the UK, you get 2 cases here, everybody just goes crazy. How do you stay engaged when you don't see those numbers anymore? And, you know, the front news is Jon Stewart's leaving The Daily Show, or, you know, whatever. I mean, I'm really sad about that because it's such a great show. But, you know, way to go. So how do you stay engaged? How do you keep interested? How do you keep driven? Because, I mean, Amanda knows well because she's been in the affected countries. I've not worked there, but I've worked, you know, across East Africa, and I've worked in India. This work is really hard, and you have to be driven, and you have to be motivated. And at the same time, you have to have an eye on what I started with, is who's got the money? Who's going to pay for this? And if the people who pay for the response to Ebola get diverted onto the next disaster or the next big thing, then where's the money going to come from that will help bring together the motivated, driven, passionate people who do this kind of work, like all of you guys in this room? So it's hard being engaged. I like your idea about getting on the dance floor, which I did last night after several glasses of wine, I have to say. So think about your networks, think about your connections, and it's at those kind of nodes where you're connected and where the restlessness is. That's where the sparks happen, and that's what keeps people engaged.
Great, thank you. And we're out of time, but I just want to wrap by saying, if you want to delve into this issue more deeply, there's a micro lab this afternoon. Lesley-Anne and Amanda and Vince Blazer from the Frontline Health Worker Coalition. And it's going to be interactive, so I highly recommend that micro lab. And secondly, around engaging everybody, I mean, I know there are a number of educators in the audience, and I know there are humanities and cultural and arts people. I'm a humanities person. And when I was delving into the literature, I'm a medievalist, so I remember all the literature around the Black Death. And there are ways of teaching Edgar Allan Poe, the Red Scare, Camus, Gabriel Garcia Marquez. I mean, there's a rich literature around fear and dealing with, you know, infectious disease. So, I mean, there are many teachable moments in the classroom around a disease like Ebola. And just one last note on the Black Death. There is new literature that is making a claim that it wasn't the bubonic plague, that it was possibly Ebola that wiped out a third of Europe's population in the 14th century. So, on that happy note, I thank you all for being here. I hope this sparked some new thinking or the desire to do more. This is a really important issue that I think about all day, every day, wake up thinking about it. So let's put our collective energy together and not let it happen again. Thank you.